Wayne had been seen at a very good local hospital and had been diagnosed with a type of heart rhythm problem. When he came to see me, we picked up that he had an additional problem, and I think that initially was a little bit of a shock to him. However, I reassured him that it's common that patients have two rhythm problems, which is what he had. He had atrial fibrillation, which is very common, but he also had atrial flutter. I reassured him that that was not particularly unusual and that we would be able to take care of both problems in the same sitting, which I think he was relieved about.
He's a great guy. I've looked at his education career path. He's at the top of his game. He's an expert in his field. But then to walk into someone who is that knowledgeable about what they're talking about, to be spoken to like someone that I would speak to on a daily basis, was brilliant.
With atrial fibrillation and atrial flutter, these are common heart rhythm problems that tend to make the heart beat very quickly and erratically. The spectrum of symptoms is huge. It can vary from people with very little symptoms, and it's picked up incidentally with an irregular pulse. So if you have an irregular pulse, get it checked out. But many people are symptomatic, and they tend to have symptoms varying from breathlessness, fatigue, lethargy, chest pain, lightheadedness. And a lot of patients will report that they just can't walk as far, they can't run, and they get very easily out of breath. I try to talk to people on a level that they're going to understand. I try not to over-jargonise things, because people, it goes over their head and they leave your consultation really not knowing exactly what you've told them and what you're planning to do.
We then looked at dates that he had available, because obviously from my point of view, sooner rather than later. So 10 days after seeing him, I'm done. It was like lightning. It was fantastic.
We have very good facilities here at the Alexandra Hospital. We have a cardiac cath lab that was refurbished less than 2 years ago. It has state-of-the-art facilities. Some of the patients that I get referred with very difficult heart rhythm problems, we need a 3D mapping system. We've got that all set up and wired into our theatre.
I understand the waiting list on the NHS is 9 to 12 months just to get a referral to see somebody before you start down the road of recovery. So to see someone and be, if you will, done is the right word, within definitely 2 weeks, 10 days to 2 weeks is just phenomenal. So for that, I am very, very grateful.
A good feature of the hospital is that we have a very high level intensive care unit. So any patient who requires high level intensive care, particularly after some of the interventional or the bypass type procedures, can be offered intensive care immediately as they come out of theatre, whether in an environment where there are very experienced nursing staff with a almost sort of 1-to-1 ratio. When you see patients like Wayne, who you've taken on a journey from diagnosis to treatment plan to completion of treatment, and then the end product, a patient who's feeling better, looking better and enjoying life, well, that's very gratifying.